I'm Courtney Virden. I'm a fitness trainer and pelvic floor expert, founder of iCORE Method, and I'm so excited about this new challenge I have with Ashley Black and Kate Balistreri.
And I'm Ashley Black, and my gig is fascia. I'm all about fascia science, fascia tools, and fascia education. And I'm very excited to be working with one of my certified Fascia Advancement Academy students, Courtney, to collaborate to help you guys.
The FAA level 2, I have to tell everybody, is incredible. Level 1 is amazing too, and level 2, you dig so much deeper. So I'm really excited to bring so much of what I learned at level 2 into this new challenge, and that's why Ashley and I wanted to do a new one. We've got so much more with fascia blasting, pelvic floor exercises. We're going to dive so much deeper and, of course, talk so much more about sexual health.
Amazing. I'm glad that you said that too about the Fascia Advancement Academy level 2, because I think a lot of people think that what I do in general and what they are going to learn is fascia blasting. Fascia blasting is an amazing resource. We're going to use it in the challenge. But that is just one tiny piece of how we can go about regenerating the fascia tissue. And level 2, we didn't even teach anything about surface tissue. We taught about getting as deep as you possibly can. So obviously that's appropriate when we start talking about our pelvic floor, our bladder, and our sex organs and everything else. So I feel like that's a beautiful marriage, the level 2 training and what Courtney is going to be doing with you guys.
It so is to be able to learn how to position your body to get deeper with blasting and just fascial work in general. It was incredible. I mean, anyone thinking about level 2, you have to do it. It's awesome. It will change your life and everyone you work with.
Well, come on, we're going to be releasing the 2025 schedule soon. And then we still have 2 level 1 trainings this year. And the last one is in the very fun Costa Rica with me the first week of December. So we'd love to have anybody who is interested in doing this professionally to come and check out that next level in your career and really in your business.
It's something everybody should do for sure. I mean, I can't speak highly enough about it. When I was there, I mean, being able to be with you and everyone else, I know everyone there learned so much and took so much away. So let's talking a little bit more right now. I want to talk with you about what role does fascia play in the health and function of the pelvic floor? Because we always think about it in terms of muscles, which are extremely important, but fascia impacts all of our muscles and is equally important, if not more, so that we can actually restore the muscle tone of the pelvic floor. And so many pelvic floor therapists don't understand that. And I'm so excited to have you here so you could share all of your knowledge that you have.
Well, I think, there's more ethereal things that we could talk about in terms of the energy, and we can go into that if you want to. But I think just from like a bare bones kindergarten understanding of fascia is there's this really big misconception out there that fascia runs in sheaths, okay? So if you Google it, you're going to see that. And I'm not saying it doesn't run in sheaths. That is just one type of fascia, and it basically does. I always say there's not 600 muscles in the body, that it's one muscle separated by these sheets of fascia. So that it does lay on the top, but also on the side, also on the bottom. So just kind of picture it like I think of it like highways, particularly in LA, where the highways come together like this, and there's like 8 layers. So we have that in the body. We have those interstate highways that run throughout, but we also have these layers that are stacked up. And basically the entire pelvic bowl has kind of like the 405, the I-10 interchange, right? So know that there's layers. But what's more important when we start thinking about the muscular system whether it's pelvic floor or your bicep, is that each individual muscle fiber is surrounded by fascia. So when we look at things and people are calling it the cobweb or the 3D matrix, what you're really looking at, and we can throw up a visual, is that each individual muscle fiber, just like a straw inside of a wrapper, is all piled up. And so when you do a cross section, what you see is sort of this cobweb, or that's what we see in meat. Like if we pull open a steak and look inside, but that is the intermuscular fascia, or what people call myofascial tissue. And where I think that the whole world has gone, is they're thinking of it as muscle and fascia, when you can't have a muscle without fascia, and you can't have myofascial tissue without the myo part, which is the muscle. So they are literally the same thing. And again, this is all super basic. The fascia, just like the muscle, has those contractive, releasing, and stretching capabilities, just like a muscle. So when we are conditioning a muscle, we are conditioning fascia. The difference is that a muscle goes from a joint to a joint and stops, and then becomes another muscle and goes from a joint to joint and stops. Whereas the fascia can permeate and penetrate, surround, be a sheath, and keep on going and be attached to something else. So when we look at the body holistically, and I love the way you train the pelvic floor because you don't isolate it, that's really what you're doing, is you're tapping into the fascia as more of a system instead of just a singular muscle or a muscle group. So I know that that is a ton of information, but I hope just in that little piece of information, you go, okay, I get it. I get that you cannot have a muscle without having fascia, and you cannot train a muscle without training the fascia.
Well, I
And
think
then we can dive into like, how do we do that?
that's such a good explanation, because that's why I love particularly the challenge and including fascial work in with pelvic floor exercises. Even though the pelvic floor work I does works your fascia, we still need more love for our fascia. And to really restore the pelvic floor and full body, you have to address the fascia, which is why I love working with you and learning the FAA and using the tools myself and teaching people how to use the tools. And it's all connected and just everything in your body, which is why we have the full body blasting and full body workouts. Everything is going to impact each other. So I think the explanation is incredible for people.
Well, the thing too about fascia specifically to the pelvic floor is that fascia is also a reactionary system. So it reacts to outside stimulus, inside stimulus. So I would imagine that your audience is largely people who have had babies, have had some sort of trauma. And so your fascia, the way that it responds is to protect. And by protecting, it gets tight and it grows thicker, just like a scar. Okay, this can be physical or emotional. So there's very few people that you just walk up to on the street, ultrasound their fascia, and their fascia looks great. So this is something that cumulatively from the time that we're born up until now, if we haven't addressed it in some way, it is going to be a signature, if you will, of everything that your body has been through in your entire lifetime. Your fascia will tell the story.
So true. So can we talk a little bit about how fascial restrictions can impact sexual pleasure and orgasm quality?
Well, I love the word restriction. In my book, The Cellulite Myth, which is really more about fascia, I say that there's really three categories of dysfunction, and it's I call it RAD. It's restrictions, adhesions, and distortions. And all of those, Courtney, can affect the pelvic floor. So restrictions is where maybe something is so tight that if this is the pelvis, it maybe pulls one piece of it forward. Okay. So that's like some kind of restriction. And we should have mobility, right? I know you talk about this a lot in that actual pelvis bowl. So that would be something where the fascia is actually physically restricting it. It doesn't matter how much you exercise, because you got to get it unrestricted. Then we have what's called adhesions, and that's just literally where the fascia comes together and sticks to itself. The easiest way to think of it is if you had a bunch of strips of duct tape and you accidentally started getting them tangled, that's what it looks like. It looks like cross-fibered, mangled, and it's very sticky. And then we have distortions, which distortions can come from all over the body. I think of it like a bed sheet. You know, I could grab the top corner of the bed sheet, but it would pull the bottom left-hand corner. So sometimes those distortions that we may actually have, say, in the femur bones or how they insert, and that's what's kind of, you know, making the pelvic floor spasm, that comes from a distortion of the whole body. Because remember, the fascia is all one gigantic piece. And so first of all, that rad can affect our pain. You know, it can pull us into pretty much everything that you can run and get a diagnosis for, as far as you know, pelvic pain, sexual pain. I definitely have seen at Texas Women's Hospital where, you know, vaginal walls are pretty much closed because the tissue is responding by clamping and being in spasm. So the first thing that it can do is help you with pain. But another beautiful function of fascia is it is the second vascular system, right?
Yeah.
And the vessels run through the fascia, but they also spill out into the fascia. So again, just like muscles can't be separated from fascia, blood cannot be separated from fascia. So when we think about our crowning moment in our bedrooms, you know, a lot of that is dependent on the quality of the muscle and the quality of the blood flow, and those two things are intricately linked to the fascia.
Yeah. Well, the last challenge that we did, I have to tell you, people were, you know, wanting to eliminate bladder leakage, things like that. They were very happy with it, the results, but a lot of them didn't expect all those bedroom moments becoming so much more enjoyable and just like change their world in the bedroom. And you and I know that exercising the pelvic floor and restoring the fascia can completely transform your life in the bedroom. And it was great. Even at the FAA, I had a girl come up and said, I did your last challenge. And let me tell you, my life in the bedroom is out of this world now, just like out of this world. And
Well, I
great.
agree with that. And I can at least tell, you know, personal stories. And, you know, I've had things like, you know, I do a lot of the work that you do for women. I do it for men. You know, it's a big part of being an athlete. If an athlete keeps getting inguinal hernias, guess what they need to do, right? And they would come in and they would say, Ashley, I'm not kidding you. I'm doing tricks with my dick. You know, but I think for men and women, it's all about sort of that ability to control. So to control the timing and to control the intensity. And, you know, honestly, I love to practice edging, and Jordy and I talk about that on a regular basis. But if you don't really have great pelvic control, it's hard to take your sexual life to that next level. I think of sex, it's just like surfing. It's some other sport that I enjoy doing. And you train for it. And you train for it just like an athlete would train for it. You know, I think with women, you know, listen, women have all kinds of issues, and we have to go through really stepping into our sexuality. But, you know, once you're at that age and that stage and that place in your life and you're working through your traumas and things like that, most women are like, you know what? I want this. I want to be like the phoenix rising. And to me, everything that we're doing is just the equipment. And if we can get the best top of the line equipment, then the doors open for tantra, you know, more regular sex without pain and things like that. So it's a gateway. This is a gateway to that, if that's something that you're wanting to explore.
Yeah, I think it's just can completely transform it. And so many women have, you know, a lower libido or maybe that pain. And that's what we're talking about with the muscles and fascia. It's often related to that or trauma. And the challenge and everything we're doing it is going to really help release that so they can actually have enjoyment again.
Absolutely. Well, I mean, I think of it just as simple as, you know, like me, I have a hip replacement and some major injuries. So I am grouchy about doing my Pilates hip circles until I do my Pilates hip circles for 3 months. And then I'm like, woohoo, you know, so I think they just have to kind of get over that hump. And it's like, do you want to drive a beat up 1972 Nova to your sex life, or do you want a brand new Ferrari? So that's what we're providing, the Ferrari.
Yeah. Well, and, you know, training the pelvic floor and fascia blasting, they're lifelong endeavor. So some people think, let me do this challenge and it will absolutely help you so much. But just like everyone knows, if they are wanting strong functional abs or core, whatever someone wants to call it, you don't just train for a month and then just never train again, or a healthy heart. It's something, it's a consistency, it's a lifelong thing. And that's what I really think is important for people to understand, men and women, that training the pelvic floor, fascia blasting, fascial care, restorative workouts, it's a lifelong endeavor,
Yeah.
just so we can enjoy life. So not only can we enjoy it now, but we're helping prevent issues in the future as well. Like with menopause, oh my gosh, so many
Don't get me
women.
started on menopause. I think I'm out the other end, so I feel like I've seen the the full gamut.
Right? I mean, menopause is impacting so many women and they feel helpless. And fascia blasting helps, pelvic floor exercising helps. I mean, there's some things that are out of our control, right? But let's
Oh
control the
man, girl, but let me tell
controllable.
you one of the biggest things, and there's like, I'm so happy that like people are actually studying women now. But there's some new research that just came out that talks about when we are lower estrogen, whether that's from our cycle or obviously in menopause, that's one of the major things, is that our estrogen starts to drop. And because of it, we start producing the kind of collagen that is thicker and stiffer, right? And so for me, that means like the minute you think you're about to go into menopause, you need to double your fascia blasting time, because you know, collagen and fascia are the same thing. Fascia is made over 90% of collagen, and then it has some ground substance and some hyaluronic acid. But fascia in general is collagen. So when we talk about the body producing a stiffer type of collagen, then that's something that we're going to have to combat. And in the world of just kind of common knowledge, you know, people will say, oh, you start to lose flexibility, you know, you have, you know, more issues with the actual structure of your vagina and all of these various things. But to be honest with you, when I read all of that, I'm like, that's the fascia. And if you could keep the fascia healthy, you're going to keep the blood flow healthy, all the stuff about becoming dry and all of that. I never experienced any of that. And I really believe it's because of fascia blasting.
Yeah,
And
absolutely. I
I'm
mean,
not stiff either, but I tell you what, I got to get in the sauna. I got to blast. I got to stretch a lot more. And I think that's because of that type 1 collagen.
yeah, I definitely think you're right. I mean, as we get older, we do notice changes in our body. No matter how great we take care of ourselves, we really have to invest even more to continue feeling great. And that's so interesting what you said about the collagen and the fascia, because to me, what I'm experiencing and people I work with, it absolutely makes so much sense. You know, so that's awesome. And let's talk a little bit about blood flow with fascia blasting, because blood flow, as we know, for orgasms, you know, getting that libido, just sensations.
Getting tight skin,
Yeah,
tight muscles, all related to blood flow. Cellular proliferation, blood flow. Oxygen to the cells, blood flow.
Yeah.
So I always just think of it, there's so many products out there and they're like, oh, it increases blood flow. And like either it's you put it on and I'm like, okay, they're not red, or, percussion guns or, gua sha tools. And it's like increases blood flow. And I'm like, well, why isn't it red? Why isn't it red? If there's an increase of blood flow, it should be red. If you use a fascia blaster, within the first 2 or 3 minutes, your skin is going to turn red. So I think that there are things that increase blood flow a little. And then I think, you have the fascia blaster, which increases blood flow a lot. And saunas also increase the blood flow a lot. We can see it. So again, it's like, do you want the crappy little car? You want the Ferrari? You have the choice here. So with fascia blasting, I feel like it's very, very direct. We definitely have theorized that we can increase circulation in general in the body, because you're not just pushing the blood through, you're actually restoring the system that houses it. So it's kind of like fixing the hose. But there's also that immediate result where you see blood flow to a very specific area that you say, I want blood flow there,
Yeah. I mean, I have to say too, prior to being introduced to the fascia blasters, I had a lot of manual fascia work done on me, which I loved. But once I got a hold of the fascia blasters, I mean, I became obsessed because I could finally do it on myself,
Mhm.
and so much more. And it just changed everything. It's, to me, like, workouts and time is everything. As a busy mom, business owner, I mean, I don't
Right.
have a lot of time, as you don't, and so many women. But with fascia blasting, you can spend a few minutes and have maximum results, just like the workouts I do, under 20 minutes. I don't have 1 to 2 hours every day to devote to, exercising and fascia work. And do I sometimes spend more? Yes, but let's face it, we're all busy.
That's
And
on a Sunday, right? That's our day where we're like, oh, kids are gone. I'm
yes,
gonna do the sauna. I'm gonna stretch. I'm gonna work out. Yeah, I feel you. And you know, I don't know how many people know this, but prior to inventing the fascia blaster, and actually once I had invented it and not launched it into the public yet, I used to do 2 or 3 hour treatments in LA on celebrities and producers and athletes and everything else. And it was easy for me to leave that because I knew that they were in good hands with the tools, and I knew that I could give the tools to another therapist because you kind of can't screw it up. And even just a few minutes a day for particularly this area. I don't know how long you designed it in the program, Courtney, but like if somebody did 5 minutes a day, that would be game changing.
but
Five
that's how
minutes.
it is in the program. So they've got this time, I'm so excited. We should talk a little bit about, so we've got the same workouts, our deep dives. These videos are going to be in. We've got new fascia blasting guides. So instead of pick an area, we're going to be directing people. There's a lot of people who want instructions on where to fascia blast every single day, right? They want this, they can open it up. Oh, I'm going to blast area 1. Here's area 1. Push the video for the instructions how to blast area 1, and then this is the workout you do today. Then the next day, oh, I'm blasting area 2 and 3. But they're all so quick. They can, if they have 4 minutes, 4 minutes, spend 3 or 4 minutes. If you want to spend 20, go ahead and spend 20. But it's very directed for people so they know exactly what they want to do. And then the people who want to pick the areas, they're allowed to do that as well. But I'm really excited because it is very written out what you're going to do. It's less than 30 minutes a day that they're going to
I
completely.
love that, Courtney. It's like a no-brainer. One of the most influential people in my life is this woman named Marielle, who I started working with when I moved to Costa Rica, and we did an intensive on yoga philosophy. And just like you and probably a lot of our audience, we're all over the place mentally, whatever. She's like, don't think, just do. It's mechanical. Just do it. And I love that about your app, because it's like, I don't need to be like, okay, well, what do I need to? No, I open it, I do it, and I keep it moving. I think that is going to be really great for compliance. People don't have time to think. They don't have time to figure out where it goes in their schedule and everything else like that. So just all you need is a 30-minute block of time. It doesn't matter if you do it on a break at the office, 30
Yeah.
minutes.
Yeah, I mean, you get them both done. Exercises, fascia blasting, you're good to go. And that's what I love. When I do that, I feel so good all day long and the next day. And the more you do them, the fascia blasting, the exercises, it's all cumulative, the benefit. So as great as you might feel in a week or two, once you start the challenge, at the end, you're going to feel incredible. And then you can keep going. And believe me, it gets better. I think so many people, and I know we've talked about this before, don't realize how bad they actually feel. They go through
Yeah.
the day just living, maybe a little pain. I saw this something, I think I told you, putting like purse Tylenol, car Tylenol, all this thing about like pain. And she's like my age. I'm thinking, you don't have to live that way, and with under 30
Isn't
minutes.
that insane? Like when you travel with someone and you're like, what the hell is that? And it's like a giant Ziploc bag of stuff that, just has to be there to have them function.
Mhm.
No, 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 no. That's where we got to peel back life and this is what I preach. I'm all like lessons from the blue zone. Like we got to be less capitalistic, simplify your life and focus on your health because
Well, and it
health
pays.
is wealth.
It is,
That
and it
is the
really
truest
pays.
statement.
What we really invest in ourselves, it really pays off. So many people our age are going to the doctor, having all that medication. And when you take care of yourself, are you going to have an issue? Possibly, but you really reduce your chances and it saves you money and time in the long run. I wanted to talk a little bit, we brought it up about emotional stress because we do store so many emotions in our fascia and especially our pelvic floor. And so I wanted to talk with you a little bit about that and how the challenge is going to really help people storing that emotional stress with the exercises and the blasting.
Wow, this is such a deep subject, and there's a lot of different schools of thought about it. But the way that I like bring it into one kind of cohesive thought is 100%. We have ways of storing emotions that is not in our brain. It's not like a memory. We can basically stuff it. You know how people say, I stuffed my feelings and I kept it down? That is a literal thing. And I personally believe that that is in our fascia tissue, mainly because fascia has something in the body that nowhere else in the body has, and that's that fourth state of water. So there is a lot of research now being done around that crystal, how we set our crystals out because they hold an energy. Well, we're lined with liquid crystal all through our fascia. So I believe that those emotional scars become more of a physical manifestation. And in different schools of thought, people really, one of the main places that we store that deep, I'm talking like childhood, painful parent, sexual abuse is in the hips, and so as a therapist, I started to experience that where I would feel sick after treatments of the hips, or I would feel energy come up into my arms. This is early in my career. Now I actually love that and I know how to absorb it. But, so if somebody wants like the scientific, like how do I store trauma in my hips and my pelvis and everything else, that's the best explanation that I have at this point for why those traumas go to that area. But if you think about it, when we are palpating that tissue with fascial blasting and even really activating it with exercise, fascia, picture it, it looks like fiber optics. It's sending energy, it's sending light. So I think of it just as simple as with our traumas, we just turn off the lights, put that away. And then when we start to revitalize it by positive self-talk, when we start to physically palpate the tissue with the fascia blaster, and when we start to exercise it, I think people are going to be really surprised, the types of emotions that they feel. I mean, I've had people blast and throw up. I've had people blast and cry. I've had people blast and go to sleep for a day and a half, and I think that is just what the physical manifestation of trauma release looks like. I think you even saw it, Courtney, in the it always happens in one of the academy trainings, either through tears or screaming or legs start shaking, and it's not an exorcism. It literally is that information and feeling got stored and you're setting it free and it wants to get out.
That was for sure happening at level 2 FAA. That I saw a lot of people. One of the women I was doing body work with the second day, she felt that so strongly. And I also want to really point out that so many women, you said turning off the lights, and I think so many women have done that from trauma, shame, fear, embarrassment, whatever it is. But when you really, I think doing the exercises and focusing on the pelvic floor, fascia blasting the pelvic floor, you're kind of taking that back, that ownership that it's you, it's your body, it's safe.
That's right.
Okay.
And that you're the adult in charge and you know how to process trauma now when maybe you didn't at the time. And yeah. It's so funny, Courtney. Next time you come down here, I'm going to take you to my conscious twerking class.
Ooh, I want
where they literally, this girl, I'm telling you, she's got the tiniest little hiney, but she can twerk like nobody's business. But it's a women's circle group. And, we talk about how we just turn out the lights on that area. And then, that's your root chakra. That's how we feel secure. And so her method is to basically shake that energy free. But it's amazing, even when you just start the movements, how you are like, oh, wow, like that almost felt like a void space in my body. I know we did this, little twerking warm up and she's like, how's everybody feeling? And my knee jerk was like, oh my gosh, I like want to go home and attack Jordy because like the tigress inside is coming out. But think about that. Imagine if you didn't even have access to those muscles or access to that energy. So that's a big part of fascia blasting, is setting that free. And a big part of what you're doing is getting that control of it.
Well, and it's that root chakra. So anyone interested in chakras and things, that pelvic floor, the muscles, the fascia, it is the foundation of your whole body and our energy. And it really impacts not just, your life in the bedroom and the bladder and bowel function and things like that, but it just impacts everything.
Well, this is my stuff I'd love to talk about, but I feel like a lot of women our age, they're ready to ascend. They're ready to be speaking their truth, intuition, connection to universal consciousness, but that's not how it works. It is one of those chakras at a time. And if we don't feel secure, which is that root chakra, and have strong energy in that area, we're not able to get there. So, I hope for some of the ladies out there, they go, ooh, that's a big one that hit me, because it's very easy to go back, shake that energy free, restore that from a physical and emotional standpoint, and then you're off to the races to build on that.
Yeah, absolutely. And when we were together last time, we were up really late chatting every night, but we've been through, a lot, each of us, a lot of things. And I really believe that so much of us dealing with that kind of stress and trauma that we've both experienced is having healthier fascia, taking care of our fascia and our pelvic floor and exercises, and really taking care of our bodies so that when we have extra stress, chronic stress, we're better equipped to deal with it and be able to process it in a healthier way and move on from it and file it away, instead of like, oh my God, my body's just freaking out. I can't even function right now. And so many people are living in that space of like fear and, their cortisol is through the roof, that flight or flight. And that's just where they're getting by. And we don't want women to get by. You want to experience life.
That's right. That's right. Those were such fun late night conversations. Courtney was not drinking. I was helping myself. I
That
was
was
like,
fun
I am on
though.
vacation. We were telling our whole life stories, but it's really, really true. And it's really sad. There's so many women that just have so many secrets. So we're not saying you got to go tell your secrets. That's one way to release energy. But, at the end of the day, if you want to transcend into, I mean, I'll speak for myself. I'm 52 and I feel like I've had an incredible life. I have 5 children. I've built a giant business, but I literally feel like I am at the start of the second half, and it is just as exciting as going off to college, you know? But a big part of that, and I'm super injured. I've had 23 surgeries, um, some related to giant breast, but most of them related to a hip infection that almost killed me. And, at the end of the day, you can't do anything if you're in pain. Like that's got to go. So we got to get you out of pain. But like you, you have to not get off the couch, getting up like you're 100 years old. Of course, one of the stability pieces of the rest of your life and all your goddessness and fabulous queendom is that you're going to have to do it in this vehicle. And so taking care of it in the right way so that it actually feels good and not just looks good, you know? So I think, once you cross over into those 40s and 50 and the menopause, it needs to be more about the way that you feel, and the look and the feeling confident and all that will just come right along with it, right?
Absolutely. I mean, I remember I'm 46. I just turned 46 and I remember turning 40. So many people think, oh, 40. I was so happy to be turning 40. And I'm excited to be 50 because I felt better at 40 than I
Mm-hmm.
did at 35, 30, 25, and much more confident with who I am. And you and I really want women to feel incredible. Like life is way too short to not feel confident with who you are, not feel good in your body, to be in pain, to just get by. Like life is beautiful. And you and I really want men and women to experience how beautiful life is. And that part of it is investing a little bit of time to take care of yourself.
Oh, reach. That's exactly it. We do not just have to accept what a modern lifestyle has handed down for what a 50-year-old can be like. I mean, I think one of the things for me living in a blue zone, which is where people live to be 100 on a regular basis and they live disease free, is, you just look at that and you go, my God, I've got another 50 years. Like Jordy and I have a goal to have, our 50th anniversary, and we're going to make it because we want it. We want it. We understand it. We live every day to the fullest. And it makes me so sad when I talk to any woman that is like, aging sucks, or, oh, my body's falling apart. And it's like, man, you gotta give up whatever you gotta give up to get that body and that mind right. Everything else will follow, but it doesn't matter if you are the CEO of a giant company and you've got millions of dollars and you can do whatever it is that you're doing. If you are miserable and you're hurting and you don't feel good about anything. I
Yeah.
see it all the time because I am in that business space as like a business mentor. And, I think a lot of times women try to shoot the moon financially, and it's not necessary. We're usually pretty happy. Give us a cute little cottage with our books and a beach nearby, you know.
That's the life. Well, and to just, we're not, I think sometimes, oh, well, you're Ashley Black. Of course you feel good. You earned your feeling good. I earned my feeling good by instead of, watching that show or going out late at night with my friends, always knowing that, you know what, I need to prioritize sleep and I want to work out tomorrow because I
Amen.
know that's going to make me feel better. I'm not special or different than anyone else. I just know I want to feel good in my body and I want to feel good. And we're talking about as people age, that like forward posture. Everybody thinks it's like gonna happen. It's happening because you're not taking
Right, that
care
it's
of
part
yourself.
of aging. It's not part of
It's
aging.
not. It's not
It's
at
part of
all. And
your habits. Yeah.
yeah, you can fix that if you have it. The challenge is a great place to start and continuing with it, and you can prevent it. And so I just think that's so important. And then let's talk a little bit about like pelvic surgeries and childbirth, because that really impacts pelvic floor function and sexual function as well. Because, like we were at the FAA, women who have had pelvic surgeries had never like blasted and done fascial work on the scars. And that, to me, that was mind blowing if you're there,
Oh,
right?
kill me. I just think of it like, if this were Derek Jeter's shoulder that had gotten ripped open by having a baby's head come through it, there would be 10,000 protocols, everything that you could do under the sun. And, I don't think that women know about it. And I don't think that women value it because it's just not something that's really been put out there in society yet. But every single surgery, and you can even ask your surgeon, is all about letting them go in there and do the thing. But then it's a race against the clock to not develop the scar tissue, right? Not continue to develop the scar tissue. And that's the way fascia scars. It keeps scarring, it keeps scarring deeper and deeper in different places. But the beautiful thing is that we saw, again, this is in ultrasound imaging, right? To places that fascia blasters couldn't reach. We saw, it's almost like, this is such a great way to explain it. This is my new thing. So if you've ever seen a spider make a web, right? They're beautiful. They're perfectly in balance all over. Okay. I believe that we have our own ability, just like a spider, to create that fascial web. Okay. Then you introduce drugs to that spider, and all of a sudden the spider web is all crazy, right? So think of it if we were the spider and we were creating our own fascial web throughout our body. So imagine a surgery. Of course, they're going to have to build the web around that. Imagine if we are taking medication, we're going to have to build around that. Imagine all the microplastics that we're going to have to build a web around that. So it's not just about smoothing out your fascia or breaking it up. What we saw in ultrasound was that our body has the ability to make symmetrical, thin, beautiful spider webs. So, and fascia blasting was the mechanism that set that off. I don't know why. I don't even care anymore. We just know that it does. So think about that when you think about your scar tissue. You can absolutely beat up on the scar tissue with the fascia blasters. We have seen that that works also, but it's so much bigger than that, Courtney. It's that you're setting off a mechanism for your body to, every time that it's producing that collagen, to lay it down in a new and different way. And this is 90 days. 90 days. And for me, if you don't F it up, basically, then it should continue. So I definitely feel like there is a restoration phase and then there's that maintenance phase. But my God, is it worth it to you once in your life to get your entire system reorganized so that your body remodels collagen in an organized way? Oh my God.
Absolutely. I feel like fascia blasting is a lot like my programs, even the full body, they're all restorative, which we're going to do some footwork in this challenge as well, because so many people have just messed up feet and it's impacting everything above it, right? Especially that pelvic floor, but your posture, your neck. And so really we want people to have better movement patterns. So when they're fascia blasting, we're going to be, as we do the workouts, restoring better movement patterns. So you're able to lay down better fascia and build it and maintain it and then keep doing it. Just gets better and better with time and easier to maintain. So maybe at first
you're saying, I even wrote about this 8 years ago in my book. It is two things. So if you get the tissue remodeling symmetrically and whatever, and remember, it only gets messed up by trauma or inefficiencies in movement or drugs or whatever. So if you get the fascia laying down and then your body is lined, chakras are lined, the spine is in the right position, feet are articulating, muscles are not imbalanced, then it has no reason to protect or come in and do anything. But it's like, if you don't do this and you do this, or vice versa, you're only getting half of the puzzle. Like, I always tell people, like, fascia blasting is amazing, but whatever you did to get it there in the first place, which could be walking funny or slumping over, it will go back. So to have a program with the both of us, like really getting everything symmetrical and functioning, this is the long-term cure.
For sure. I mean, you and I have felt it. We've seen it with countless clients and people we've worked with.
Ourselves.
Yeah, ourselves, for sure. I mean, that's it too. We're like our own testers, right? Like, you can't fix someone else unless you fixed yourself.
Agreed.
I really want to talk, so many people's hips are so locked up, whether, we've talked about so many reasons why. Exercising definitely helps, but again, the fascia is coating every single muscle fiber. So we've got to get that fascia to be more flexible. And so I really want women and men to understand that, fascia blasting and fascia work is just so important for that flexibility, throughout your body, but especially, the hips, the pelvic floor. And think of even, when women orgasm, it's that rhythmic contraction and relaxation of the pelvic floor, which is the muscles and fascia, and the nerves have to be firing and the nerve pathways open. And that's just not going to happen optimally if our fascia and muscles are not working correctly. And, some people say, my sex is great. Well, I don't know anyone who's ever said sex is too good, I can't get it better.
No, I totally agree. I mean, there's just so many things that, lead to great sex. And, obviously, partner has something to do with it. The emotional excitement has something to do with it. And all of those things, that ain't my expertise. But my expertise is having the body to be able to get in all of the positions that you want. And that has a lot to do with hips, and having the control over the muscular system and the fascial system, because you're right, that is what allows you to have better controlled, harder orgasms and quicker recovery for multiples,
Yeah.
and I feel like this is one thing in the world, I probably annoys you like it does me, is like, I see all these people doing hip openers. And it's like, rocking your knees back and forth. I'm so sorry. That's not going to get your hips open. The
Yeah.
main place somebody needs to focus, and I don't haven't even seen the program, and I'm sure you do it, but we need to be deep into the front side of those hips. Particularly that psoas muscle and that deep interior fascial line, which is probably why Courtney has you blasting like the lower sides of the abdominal region and into those upper inner thighs, because that's where those fascial attachments are. If those aren't loose, you can stretch your glutes all you want. You can do every single yoga pose on the planet, but your hips will be jammed, because that fascia and the psoas muscle drag the hips up into the pelvis, and then it's impingement, not tight muscles. Does that make sense?
Yeah. And I've worked with a lot of women who are, they consider themselves super fit, and they do a lot of traditional abdominal exercises. And then when we do some of even the pelvic floor, it's like, why is this so hard? I can hardly do it. And it's because they're training really not how our body functions, right? So they might look great, but their body's actually not very functional. And that's where, with the fascia blasting and all the restorative exercises, we should be working out so we are good movers. We should be doing fascial work so we're good movers. Like, to me, fitness is not how we look, it's how we move, right? And I know you're that way too, that if you're a good mover, you're going to look and feel great. Like when I was with you at FAA, we were up against the wall doing posture. You and I do such a similar posture check on people, right? And people aren't looking at like the foot and the toes and what it's doing, but it all matters.
Yeah, it all matters. I know for me, it's interesting because I'm about to do some press coming up around next year. And I'm like, you know what? I really would love to be leaner for that. And if you're training to be lean, that is completely different than training for life, right? So I don't normally train to be lean and I don't normally diet to be lean. I just eat healthy and the body's going to do whatever it wants to, right? But on the flip side of that, like my schedule for what I do, I'm in the sauna probably 3 to 5 times a week, and I'm blasting and stretching and listening to Joe Dispenza. I'm trying to kill a lot of birds with one stone in there. But that I do that. I get treated 2 to 3 times a week by a practitioner.
You're a good girl. I
And
like her.
my workouts, like what I enjoy doing is surfing, which requires mobility in every single joint in your body. Cause I'm not out there, on a knee high wave getting my picture made. Right. And I do Kung Fu and all of the steps that lead up to Kung Fu. And when you watch somebody who does Kung Fu move, think about a ninja, the way that they can do those low squats on the floor. For me, that is like my victory dance, with a hip replacement and all the surgeries and everything I've had. And I remember the very first time I saw it, I saw somebody testing to do Kung Fu, and I looked at that movement and I said, I want to be able to move like that the rest of my life.
Yeah.
So when we start picking things, when we do closed chain movement like bicep curls and tricep presses and all of that, it's not bad to do that. It's just you need to know that you're doing that for a look. Okay. And the other things that we do are for our function. So either you can balance those in your life or you can take on your look at some point and take on your function in another, but we can't ignore the function.
Yeah. I mean, I've trained for function for over 20 years. I don't lift any weights. I don't do any traditional abdominal exercises, but I feel great. It's because that's how I want to feel. I want to feel once I stopped, for me personally, lifting weights, I never felt better. It was
Yeah.
making me so tight. It wasn't what my body wanted. And I just want, if someone loves doing that, by all means, like you said, do that, but it's not it's not a like longevity, get your body moving
Right.
correctly.
And it's also for a look,
Mhm.
everybody thinks that that's like to get you strong, but it's not. Trust me, I come from the bodybuilding world. And once real bodybuilders get to be 50 or 60, they can barely walk,
And
you
so
know?
many pee their pants.
Right. It's just different. It's not right or wrong. But I do think that, since we have an older crowd, that we need to be like, look, running and banging and lifting weights. Like if you really want to continue that, you got to have all this stuff over here to sort of undo that and also get ahead of the curve in terms of movement.
Absolutely. And when we were talking earlier about menopause, so many women, I mean, statistics say half of women in menopause have bladder leakage, but I really feel that when you look at all the statistics with women in pelvic floor, it's so underreported because I know so many women who have never told anyone until I
Yeah.
ask them. Most women I know, like I have a client and he was like, every woman I've asked has bladder leakage. Like he's asking all his friends when he's going over there, the couples, and every woman's like, oh, every single friend of mine does. And that's not normal, even though it's common. We don't have to live with bladder leak,
Right.
constipation, not wanting to have sex, or, not enjoying it, back pain, all of those things. It's so much easier than people realize to restore your body so those problems go away and then prevent those or other things from coming back.
Yeah. I agree with you. I think that there's way too much shame involved in these things that are, like you said, they're not normal, but they are very common. And it really is just that, childbirth, no matter whether it's a C-section or a vaginal birth, it does damage. And I don't know about you, but I didn't get any rehab.
No, I got
Not
none.
even a sheet of paper that said to do this. So I just think it's something that's gone unaddressed. You know, and when you think of leakage, it's because, you know, the fascia actually surrounds the bladder, and then you have the pelvic floor muscles that hold it, you know, up and in so that it's not
Hopefully.
requiring, yeah, exactly. And so, you know, if we have damage and trauma to, you know, let's just say that whole area, and we don't have an effective rehab program, well, what do we expect? You know, and
Oh,
that's
yeah.
sad. That's sad that, like, you know, women doctors, I'm probably who you have, and I follow Dr. Mary Claire. It's like, it's just not even really taught, you know,
Oh,
so
no, they're
we
not
can't be mad
asking.
at doctors because they are not doing pelvic floor programs. We can't be mad at doctors because there's no fascia programs. They don't learn it. It's more of like an institutional issue that we got to push to the forefront and get
Yeah,
these simple programs like what you're putting out there into the hands of every single woman, you know, and from you know, during pregnancy or even pre-pregnancy, you know, prehabbing and then afterwards rehabbing, it should be a must.
absolutely. It should be a must. It's not asked. I know hardly any woman who was asked about pelvic floor function after babies, and they've all had issues. Actually, at FAA, one of the women I was working on, she's like, "Oh, I don't have any pelvic floor issues." I'm like, "Well, that's great." She said, "I don't have bladder leakage." I said, "That's great. You don't." There's also other symptoms such as like frequent urination, feeling like you can't fully evacuate, lower back pain, constipation. And then I started naming all like several. She goes, "Oh my God, I have everything else." I said, "Yeah." So I
Right.
think people think pelvic floor dysfunction is bladder leakage. While it is bladder, bowel, back, sexual. It's just, it can be
Well,
everything,
it's like people think menopause is hot flashes, and it's
right?
like your entire biochemistry is going to change, you know?
Yes. Well, I had
So,
so
no,
many
this is,
issues.
it's beautiful, Courtney, because, you know, you can tell just by listening to us, you know, this is not a Tuesday afternoon for us. This is like our passion. And it's because we see so many people suffering, and it's just nonsense. There's no
It
reason to
is.
be.
And that's what I like too about, the app and the programs and the fascia blasting and our challenge that we have is it is accessible to everyone, right? Like no matter where you live, whether you have a pelvic floor PT, a great massage therapist who knows how to fascia blast or do fascia work, it doesn't matter because we're bringing the tools into your home. It's so much quicker. I told someone I have not worked out in a gym over 20 years. I don't have to drive, even if it was 5 or 10 minutes away, round trip, we're talking 15, 20, 25 minutes without a workout. I'm already done with my blasting and my workout by the time someone went
Right.
to and from the
And
gym.
Courtney, you know where I live. There's not a gym within 90 miles of where I live.
No, there is
No,
not.
I have to do everything at home, and it's amazing. I have a very comprehensive program right here in the house. I know some people like the gym for the social aspect, and I'm all for it. But, you know, if you're a busy person and if you're saying, "Oh, I just don't have time for XYZ," then you need to find a way to do it at home.
Well, I always find too that a lot of people I know, like, oh, I want to lose weight or do something, and they're doing an hour every day to maintain something. That's a lot of time. That's great if you always have it. But what happens when life gets busier and now you don't know how to maintain what you were doing? And that's
Right.
what
And
I love.
that is the thing that goes away. Yeah.
That's why I love like quick at home. It's very inexpensive compared to what you'd be paying for a gym or a therapist. It's just
I mean, I look at the cost of my tools, and you can get a comprehensive kit for the price of one treatment,
yeah.
you know, and we even have, you know, the payment system where you can make payments. For me, it was imperative that my tools were affordable for everyone. And I feel like it's a one-time purchase, and you have it for the rest of your life. Like that, you can't get cheaper than that and better than that, you know?
Oh yeah, it's so when you compare, I think people look at like price so differently. It's what's important to them. But when you think of a gym membership, one session with a therapist, a session with a trainer, a session with a physical therapist, they're very expensive depending on where you live. Here, you're going to be paying $200 plus. You could get all of the tools. You could get the app for a year with like the cost of 2, maybe 3 sessions, and you're going to be able to do 2 or 3 sessions up to 7 in a week with what, we're offering people. It's just, and it's attainable. A lot of people don't live by someone who is even qualified to treat them or knows how to,
That's right.
restore their body properly. I think like pre and postnatal, people are like, I'm prenatal certified, postnatal certified. Well, what does that even mean? Are you even checking people for the right things? Are you actually restoring them, or you just know how to safely lift weights with them after, but really not make a
That's
difference?
right. That's right. Courtney, this was awesome, as it always is, being with you in person. And you're just such a genuine, amazing healer. I'm proud to call you friend and colleague, and I'm super excited to be a part of your challenge.
Thanks, Ashley. I feel the same about you. I always love getting together with you in person or virtual, and really love the challenges that we do because you and I really have the same goal and use a little bit different modality, but they blend so beautifully. I'm really excited about this new challenge with all of the new updated information, bringing in everything I learned at FAA. This is going to be an incredible challenge nobody should miss.